Right, perfect. Let me just get into position.
Okay. It's on now.
And, alright, good.
Okay. Hello again. My name is Dr. Michael Ballas, and I'm going to talk about another part of my holistic healthcare practice, and that is the use of chiropractic care. And for this demo, I'm also going to use my son Ian at this point to demonstrate some of the techniques and approaches. First of all, why chiropractic care? The first myth I like to dispel is this, is that chiropractic care is for backs, necks, and pains. That is not the case. Now, that's not to say that chiropractic care does not help some people with backs, necks, and pain problems, because it certainly can. But what I'm going to do right now is demonstrate with these plastic vertebrae. These are representations of the bone in your spine. I want to demonstrate what the purpose of chiropractic care is and why it can be invaluable in regaining and maintaining your health. So what I'm going to show you here is the following. These are the vertebrae, the spinal bones. They're stacked one on top of the other. And what you look at here is I'm going to hold it on the side. You'll see coming out here, that structure is your spinal cord. Why is this important? The nerves that come off the spinal cord and the spinal cord itself are the connections between the brain and the rest of the body. Okay, great. Maybe you didn't want a neuroanatomy course, and I understand that. So why is that important? Your brain, in terms of your body, is command central. Your brain receives signals and sends signals out. We call them nerve impulses. We've heard of that. Now, why are those important? That's what keeps you functional and alive. Guess what? If we lose those nerve signals, you're instantly dead in terms of function. Instantly. Now, so this is a real important system, and it's got to be protected. Most of us know, hey, the brain's sitting up here in the skull. Well, the skull protects it pretty good unless you get bopped on the head real hard. But what about your spinal cord and the nerves that bring brain signals out to body and vice versa? Well, they're protected by the individual vertebra. And we see here, by the way, that's a nerve. That's representing a nerve that comes off your spinal cord. Where does this nerve go? It could go anywhere. It could go to your muscles. It could go to your organs. And guess what? It literally brings it nerve impulses. Think about it almost like bringing life to your entire body, because that's very, very accurate. Now, what would happen if I cut one of these nerves? What do you mean? Suppose I cut a nerve. It was going to your arm. How do you think your arm would act? Somebody said to me the other day, I posed that question. I said, well, your arm wouldn't work. I said, exactly. But suppose instead of cutting the nerve, I squeezed or irritated it. And I'm going to demonstrate it this way. These vertebrae, by the way, are movable. But suppose these vertebrae got knocked out of alignment and then started to put pressure on that nerve. If you're thinking that nerve wouldn't work right, you're entirely correct. And guess what? People get these lots of times. Where do they get them from? Minor traumas where they think no one's hurt. Kids walk and learn how to walk and they fall a bunch of times, but everything's fine as long as they don't break a bone, right? Maybe. Anyway, these misalignments of the spine that irritate nerves are called subluxations. It's a huge word, I guess worth $75 on eBay, but we'll find out. But anyway, these misalignments or subluxations can cause pain, numbness, weakness. Guess what? They can also affect your organs. They affect your immune system. Remember, your brain is command central. Now, if you got one of these, do you know it? Not necessarily. Don't all of them hurt. But guess what? As chiropractors, and I am a chiropractor by license, we can correct these with a procedure called an adjustment. Now, people hear chiropractic care and they've been given some false information. It's dangerous. It's painful. I've even heard people, by the way, the healthcare professions tell people not to get them. It makes me fairly upset because you know why? It's doing people a disservice. And frankly, it's done out of ignorance, even if it's someone with a degree who said that. Now, how are these adjustments in chiropractic, realigning the bones, work? Well, listen, if we realign the bones, we take pressure off the nerves. Guess what? Pressure off the nerves means your body works better. Well, guess what? You can follow that, right? If your body works better, doesn't it make sense? Is a better chance to heal and then stay healthy once it is? I think it makes sense. It always made sense to me from the time I trained as a chiropractor. Now, how are these adjustments done? They can be done in a variety of ways. I've adjusted children days after birth. Yes, days after birth. I adjust people who are in their 90s. I have one gentleman who's 100 years old. Now, I'm going to show you just one way that a spinal adjustment, realignment's done. I'm going to use my son Ian as a demo. Now, Ian doesn't need an adjustment, so this is just strictly a demo kind of thing. So, Ian, lie on your stomach for me, please. On your stomach. That's okay. We're going to keep that in there. It's a good part of it.
Oops.
All right, it's all good. Now, here's the deal. When you need a chiropractic adjustment, sometimes they're done by hand. I don't do the majority of them by hand. There's nothing wrong in doing that way. But what I use is a specific instrument, and this is called an activator. It doesn't really matter, but here's the deal. When we find by an analysis that there's an area, hey, there's an area here, just pretend that there's a subluxation, there's a bone out of place, and it's causing nerve problems, what I do is I give an adjustment. What do? I take this instrument and literally just go like this. Now, I didn't actually do it to him because he doesn't need it. But this literally delivers a very small force in a specific area so the body can realign that vertebra. No pain, 100% safe for every person of every age. I can use this with women who have osteoporosis. I can use this with people that I have who come in who have cancer of the bones. And guess what? They're uncomfortable, they hurt, but guess what? I can't put any kind of force in there. Their bones might be real brittle. Any person of any age can be adjusted with this technique. That's why I really love it a great deal. And that's the idea behind a chiropractic adjustment and chiropractic care in a holistic health practice. Thank you.